what are the risk factors for a child to have autism? So basically, based on the research, there's no clear factors or etiology to say that if you take this or if you do this, normally people will link it with nutrition, the way you eat. So they say, oh, because you lack of some milk, something gluten or something like that, so it can cause autism. But there's no clear evidence to suggest that it's the cause for autism. Mostly it is multifactorial. It's because of the genetic factor and also the environmental factor. So among the factors that has been identified through research is advancing age. So if a maternal or the mother age more than 40 years old and the father more than 55 years old, when they conceive a child, so there's the high risk for the child to have autism, but not necessarily, I mean, not, I'm saying the high risk, not a definitive factor that they will have autistic child. So other factors include, or other risk factors include prematurity of less than 33 weeks of gestation, or if the child have problem lack of oxygen during birth, or the mother is exposed with toxins during pregnancy, and also family history. So study shows if you have a sibling who have diagnosed with autism, so there's a high risk that your other child will have autism as well. But not only autism, if the child has any other neurodevelopmental disorder like ADHD, learning disability, and so on. So there's a risk for your other child to have autism. Okay, so basically, this is something that I take from National Autism Research Center. Okay, the pathway, how to know whether my child have autism or don't have autism, when can I identify these symptoms and things like that. So normally it begins at the routine development screening, healthcare clinic at the age of 18 months, 24 months, 36 months, where you take your child for a routine checkup. So the doctor will see whether the child fulfill the developmental stage that they should reach by that time. If the doctor thinks that your child does not develop according to what it's supposed to, then they will refer to the audiologist and also to the ophthalmologist. So this is to make sure that the child don't have any hearing or visual impairment. Okay, so means that their hearing is okay and their vision is okay, yet they have the problem you think that the child have, or not normal, like not like other children. So if the hearing and the visual test okay, means there's no problem at all, then proceed to the step 3, which is the MCHAT screening. So this MCHAT screening can be done by the primary care doctors, even at the clinic. Okay, so if the score at the MCHAT screening indicates the risk for autism, then only the doctor will refer to clinical psychologist. Some of the doctors will refer to pediatric first. Some will refer to child psychiatrist. So that's okay. That's fine. Okay, and then because like I say, one autistic child and another autistic child, the symptom is not the same. So some have very mild and subtle autism symptoms, and others is quite obvious or significant. So if it is quite obvious, so normally doctor will give the diagnosis there and then. But if it is like not really sure, the symptoms is quite subtle, or if you want to know the level of severity, normally they will refer to clinical psychologist to confirm the diagnosis of autism using using CARS and GARS questionnaire. So I will explain a bit about this questionnaire later on. I saw a question, but I don't have time to read it, but I will go back to that later. Okay, so after we confirm the diagnosis that the child is actually has autism and at what level, whether it's mild, moderate, and so on, so we will refer to occupational therapists and also for to speech therapists. Occupational therapists for behavior intervention and speech therapists for the communication part. Remember the autism characteristics divided into two, which is the communication and also the behavior problem. So therefore, that's why we refer to occupational therapists and also speech therapists. And if you have quite a good financial, so you can enroll them in an early intervention program, because early intervention program can be quite costly. So early intervention program it's quite comprehensive. They have occupational therapists there. They have speech therapists in the program. It's like you send the child to kindergarten, but a special one where you have in-house occupational therapists, because some have clinical psychologists and also occupational therapists in there. Okay, and also parents actually entitled to apply for OKU card for the child under learning difficulty, because under learning difficulty there's like ADHD, autism, specific learning disability. So you can apply it under autism, okay, and so you are eligible to get this OKU card. Okay, a lot of benefits from getting this OKU card actually, and you can go to the Social Welfare Department website and look into the benefit when it comes to education. Okay, some parents quite concerned, like, is it okay if I don't register for OKU? You know, what if other people know that my child is OKU? Okay, I don't need all that discount in utilities and things like that. Okay, but just yes, maybe parents don't need that kind of benefit in terms of discount in utilities, but what more important is what the child can gain from the education part when they have the OKU card.